travel bans, as we're starting to find out, because more and more countries are now discovering cases within their borders, and in some cases with local transmission, travel bans have limited utility, particularly when, the bullet is already out of the gun. You already have a lot of sort of cases around the world. I think that testing and requiring vaccines for travel and potentially requiring some level of quarantine after somebody travels might be one way to slow it. I have to say that the best way that we can do this is keep our vigilance up with non-pharmaceutical interventions like masking. And as you've heard, I'm sure many times over this weekend, is vaccination. We need to ensure, as you've heard from the vaccine manufacturers, that you may see sort of decrease in, if the worst case scenario comes up, you may see a decrease in efficacy, but our current vaccines, as well as the boosters, may still provide protection.
Okay, so some protection is better than nothing. How quickly do you think pharmaceutical companies can tweak their current vaccine lineup to fight this new variant?
So what's going on right now, the testing that they're talking about is something we call neutralization studies, where they're looking to see if the virus can actually the antibodies that are in blood for people who have been vaccinated can actually control this virus or not. And if they find out that the activity against this virus is much reduced, what Moderna has said is about 60 days to get a new candidate. Pfizer has said about 100 days. Johnson & Johnson said they're starting to look at this. So you're talking about a matter of months to first get a candidate that could go into clinical trials or into clinical sort of practice. And then you have to have manufacturing, which is going to be another couple of months. So you're looking at 5 or 6 months, which is another reason why if you can't wait, you have to get vaccinated today with the vaccines that are available.
Vaccination is one thing, but there seems to be so much vaccine inequality, and that's the reason why South Africa is in a position it's in. What are we doing? Do you think developed countries are doing enough to get the vaccine out to the much-needed developing world to try to immunize the population as well?
I think, Christine, the inequality is just, it's a human rights issue. It's immensely, unfair, because what you're seeing is in most of the world is that 50% of the world has one dose. But when you actually look at low-income countries, less than 7% of the population has gotten one dose. And the continent of Africa, in fact, South Africa is much better off than many of the other countries in Africa. South Africa is about 30% fully vaccinated. The rest of the continent is about 7%. And what you've seen is that even efforts like COVAX from WHO, the reason that they've sort of fallen behind is because rich countries are getting ahead in the line and buying up the doses as manufacturers are producing them. And so donating is one thing, which I'm glad some countries are doing, although the doses haven't gotten to the countries that they should be getting to. But the other thing we need to do is actually improve the manufacturing capacity in more parts of the world, not just to combat this pandemic, but also the future one. Because, Christine, if we need boosters more regularly, are we going to keep having this growing inequality get worse over time, if you will?